Hello, everyone. Here's my disclaimer. The views discussed in this interview that the guest says may not represent those of the station or the host. Please discuss any information that you hear with your primary care physician. Hi, everyone. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio, where our mantra is to educate, enlighten, and entertain. Folks, I am so blessed and grateful because I do have a phenomenal guest on. I have a phenomenal guest on today you are going to want to hear. So much information. My guest is phenomenal. I had Dr. Catherine Kelly with me, who has a PhD, Master of Science of Public Health. She is a best-selling author. I don't know how she had time, but she wrote 3 books. She wrote The Healer's Path to Post-COVID Recovery, A Restorative Journey for Healthcare Workers, which is the book we're going to discuss today. But she also wrote Soul Health and Recipe for Radiance, which can be purchased on Amazon or on her website, which we will give later. Dr. Catherine Kelly is a clinical psychologist, best-selling author. She's a speaker, coach, and organizational enhancement consultant. She was former director of behavioral science and family medicine and medical school professor at Wake Forest University. I don't know how she had all this time to read, to write these books, folks, but I'm glad she did. We need to hear what Dr. Kelly has to say, because I'm telling you, folks, I know when I went to my doctors, they were burnt out. Nurses are burnt out from before COVID even started, and then to deal with what they had to deal with. This book is necessary, very necessary, and I can't wait to hear what Dr. Catherine Kelly has to say. So welcome, Dr. Kelly, to Chatting with Betsy. Thank you for coming on and writing your books and doing what you do.
Absolutely, and thank you for having me, because you are right. This is a very important topic, and we need to get this word out there as much as possible.
Yes, so could you please tell the audience, what is this book about? I mean, obviously the topic is self-explanatory, but what motivated you to write this book? And who needs to read this book?
So although, let me answer that one first. Although this book is, by the title, it's intended for healthcare providers, one of the things that I think is very important to know is that healthcare providers have families, they've got friends, they've got coworkers, they have people who need to understand what they've been through. And also patients, patients who really need to know what their healthcare providers have been through. This would be a very good book for any of them, because, or if you have healthcare providers even in your extended family, it's just a book to help people understand what they really went through, how it changed them at a deep level, basically also to help them cope in the future, because, I think one of the main things that I'm going to probably explain today is that anybody who has been through a traumatic or a very stressful event, oftentimes it doesn't affect them till 3 to 5 years later. I mean, it really start to impact them and set in. So, I think in the years to come, we're going to see how much of an impact COVID had on healthcare providers. But this book is written basically as a restorative process. One of the things that I told my book coach early in 2021 was that healthcare providers have a protocol for everything but themselves, and they needed some sort of a blueprint or a plan to help them recover and help them work their way through how this thing has changed them. And that's really what this book is intended to do, is help them recover, help them rebuild their lives, help them rebalance, and become a new them, because this has definitely changed them at a deep level.
Oh, absolutely. I know going to my own doctors, they were burnt out. As a matter of fact, my son's doctor, my cardiologist, said if I had to practice in the hospital, they would have quit. They would have retired.
Yes.
A lot of doctors are retiring, a lot of nurses, and I feel Dr. Kelly, and, when people, nurses, doctors, healthcare workers, even caregivers, we do what we have to do when we have to do it, and then comes the crash, I call it, the burnout. And I'm sure you have seen that tremendously happening with the healthcare workers that come to you.
Absolutely. And, it's you and I chatted very briefly before we started, and I said that, this is in the book, very first chapter of the book, is that the research was very clear that healthcare providers were already burned out about 3 to 5 years prior to the pandemic. And this event, because of this, so many of the different facets of this event and how they had to really adjust and pivot and learn so much more all of a sudden, it really flattened them. It was one of those things where they didn't see it coming. Healthcare systems were not prepared. They were already short-staffed. They were already worn out and exhausted and overworked in many ways. And this event has really taken a toll on them in terms of personal lives, professional lives, ability to cope. I mean, there are so many different things that have happened that I just think it's important both for them to understand and normalize this whole experience they've had, that what they're feeling is, expected and normal, but then also for those who read it who are not healthcare providers, for them to understand that, this is a time to really have some compassion in reverse, meaning, healthcare providers are supposed to be comforting and compassionate to you, but now it's a matter of how do we support our healthcare workers in the process of us getting well at the same time?
Yes, and I can tell and I know that the healthcare doctors, nurses are suffering from depression. My cardiologist, and I went to see him in 2021, and he said, he goes, I'm depressed. I mean, he admitted it to me. And,
yeah, no doubt.
And we tend to put nurses and doctors up on pedestals, and we have to realize they're just like the rest of us. Yes, I worked as a nurse. Yes, we see people die, but not the amount that doctors and nurses saw during the pandemic. They was like in a war, seeing death every day and a lot, probably second-guessing themselves. Did I do the right thing? Did I order the right test? Did I do this? I could see where they were burned out before this pandemic, and then during. I talked to a emergency room doctor 2 years ago, and she was having post-traumatic stress. And I think that doctors and nurses should be able to go for mental health help without it being counted against them, without penalty for their license, especially doctors. And we need to stop the stigma of when a nurse or a doctor needs to go for mental health. We don't hold it against anyone else. And, I'm a big mental health advocate. Mm-hmm. And, everyone gets to a low point at some time in their life. And, they did go through a type of war, and it is traumatic, and they do have post-traumatic stress. And I'm sure it's going to affect them in their future. We go to a hospital, especially the emergency room, the waits are long, and doctors are leaving in droves, not just because of pandemic, but the way just the whole healthcare system is. And nurses are burnt out, and it was always short-staffed. I know I had 18 patients on a night shift, 12 to 18 patients I had. And you're going back 38 years ago. Right.
Yeah, and this is one of just one levels of trauma is that, healthcare providers are basically assumed to have their acts together so that they can take care of others. The challenge is not only are they human, we're all human, as you're a healthcare worker, I'm a healthcare worker. We have our own stuff going on, but then when we're expected in a very extraordinary situation to still have our act together, it is unrealistic. And that was one of the things I heard over and over again in the very beginning of doing these interviews, is that many of the healthcare providers said we didn't enjoy or like being called heroes because we didn't feel like we knew what we were doing, and we felt exhausted all the time, and we were scared too, and we didn't know what was going on. And so it's really interesting how the identities of these healthcare workers were portrayed in the news as being heroic, whereas all the while they feel like they're falling apart. And it was really sobering for me to hear all of that, because I knew for me I was worn out, I was exhausted as I started these interviews. But hearing ICU nurses talk about it, emergency room attending physicians talk about it, even all the way to emergency workers in terms of paramedics, all of these different walks of the healthcare life were talking about the same thing, that they didn't feel like they knew what they were doing because everything changed so quickly. So there's an identity shift. There's an identity crisis that was happening with healthcare workers, that was happening on top of the the overall day-to-day stress that was happening as well. So it's multidimensional, and that's why that's a big reason I wrote this book, is to help all of them know that there is a path to their restoration. There is a path to healing, even though they don't, they didn't have it at the time, because they're so used to helping everybody but themselves.
Yes, and it is uncomfortable being thought of as a hero when you're doing what you need to be doing. And nurses and doctors, yes, they fall apart. And I know, Dr. Kelly, that the old boys school of thinking, you're a doctor or even a nurse, toughen up. This is what you went in for.
Yes.
The old school thinking, you're not supposed to fall apart. This is part of your job. How can you not fall apart when you are seeing people, more people than normal, dying in front of you, and families not having closure, not being able to be with their loved ones, nurses holding the phones for these people who were saying goodbye to their loved ones, not having the proper equipment. That was a big thing I've heard over and over again. Not having equipment, having to soak their mask in bleach or other chemicals and inhaling that. What's going to be the side effect of that in years to come? Being away from their families. Some nurses and doctors weren't even with their families during that time because they were afraid of giving them COVID. They did a huge sacrifice. Go ahead.
And that's why I said, that I don't think they're all going to know what hit them until later, because in the typical form of PTSD, what patients or individuals in general experience is they just want their lives back in order. They don't really want to deal with the immediacy of the acute stress. They just want to feel normal again. They want to feel in control again. And so a lot of times they package it. They shove it down. They ignore it. And then they can't help but have it come out later. And so I do believe that it's going to be very interesting to see what happens with healthcare providers in the next 3 to 5 years because of this. And not to mention the fact that in the midst of me doing these interviews, people were already having divorces or separations. People were already having some pretty intense discord with family members. Many of them have, quote, broken up with family because they didn't have the same values or they didn't follow the same precautions. And so, it was really interesting that everything that we saw going on in the public was really happening, obviously, within these healthcare providers' lives as well. As far as the PPE, it was really interesting in the very beginning because a thoracic surgeon told me in the interview two things that I think will be of interest in our talk today. The first thing he said was, it was shocking to me, because one of the questions I asked was there anything you were shocked about in this process? And he said, well, a few things. And the first one was, number one, that a pandemic could even happen. He said, here I am, newly married, infant child, building a new life, and then all of a sudden this starts to happen. And he said it took everybody, including me, a while for it to sink in that, wow, we're really having a pandemic. He said it was just shocking to believe we still could. Number two, he said it was shocking to know that one day when he walked into work, got his, his gear on for his surgeries, that the cabinets were full, full access. And he said literally the next day I'll walk in and they had locked the doors, that we couldn't get our own, we did not have access to, the scrubs or anything else they needed, because basically they locked it down and they said that they were low in supply. He said, so how is it that overnight we're suddenly low in supply? He said it was just baffling. And then he said part three, one of the things that he was shocked at, again, that strongly impacted him, was that he ended up having a headache, a pretty severe headache. He says, I never get headaches. I rarely get headaches. I had a very severe headache. I called into work, and they said, you need to come in anyway. And he said, I've never called in sick before, and they demanded that we come in. And he said, I made it through my surgeries, and all the while I'm thinking, boy, I wouldn't want to have a thoracic surgery being done by someone who's got a major headache. And he said, and then, not too much later, we found out that headaches were one of the main symptoms of COVID. He said, I'm certain I had COVID, but I didn't even know it. So he said, I was putting people in danger without wanting to, because I tried to call out, but my workplace told me I had to come in, and then later we realized we were probably infecting people. So there's that guilt there as well. There's that individual guilt, and then there was the anger and the frustration toward administrators for telling them to come in, even though they weren't feeling well, they weren't feeling taken care of, they were already burned out. There were so many layers to what was happening that I just think there are going to be lots of layers to untangle later.
Yes, I agree. I live in New Jersey, Dr. Kelly, and the veterans homes here had a lot, sadly, in nursing homes, a lot of deaths from not separating the COVID from the patients, from the non-COVID patients, and workers coming in, because a lot of these, especially the nursing assistants, worked in more than one job. And even though they didn't feel well, they were told to come in. And there was, unfortunately, an investigation, but a lot of people died that probably could have been prevented. But I know way before COVID even happened, they did not like when someone called out for a shift. It was not. It was not looked on something great to do, especially on a weekend or holiday.
Right.
But healthcare people do get sick, and they were practically forced, I would say, into working. And they didn't just work 8 hours; they worked 16 hours a day.
Right. Right.
And
I can't tell you the number of healthcare providers who said they had marital problems or relationship problems during, the time that I had been interviewing them, and it was because of the intense stress and the lack of support they either felt from their partners or that they could give to their partners because they were gone all the time.
Yes. Yes, they were
so
definitely.
There's a whole other level. Yeah. There's a whole other level of difficulty that is going to be unfolding eventually, because I would be curious what the divorce rates will turn out to be. I don't think anybody has studied that yet.
That's very interesting because I know with the night shift of nurses, it seems like a high divorce rate, even way back when, because you're not home at night. And not being sexist here, but, it's kind of strange. The female could work night shift, and the guy, is thinking of, I don't like to be in bed alone. Yet when a man works the night shift, I don't think as much problem with the women, going off to looking to fill their bed at night. So I don't know if you see that more as men having difficulty with their wives or their partners working night shift versus the other way.
In my experience of interviewing, it was a mix, honestly. What was interesting is I'm trying to think how I don't know that I've actually counted the number of people. I know that it really was a mix for whom I had interviewed. I know there was a couple that both of them were nurses. One of them was an emergency room nurse, a critical care nurse that traveled. He was a traveling nurse. And then she stayed home because they had 3 young children. And she noticed that he was getting more distant. She was noticing that, he was just not coming home as much, and he kept saying, I'm just so busy. Well, it turns out that he's having an affair with one of the other traveling nurses. And it was one of those things where I interviewed him later, and he said, and he was very remorseful, but he said, I realized I had more in common in the moment with other traveling nurses than I did my wife, who was a nurse at home. And so a lot of what was happening is that healthcare workers don't really lean on one another wholeheartedly anyway, because of that whole idea that they have to keep it strong and they can't show weakness. And so they might lean a little bit, but during something like a pandemic, they really felt a kindred energy with a lot of their close coworkers because they were going through the exact same things, and they didn't have to explain to anybody what was going on. So I think that there were probably more affairs than we even know about. I think there were probably many more even emotional affairs. It might not even been a sexual affair. So I think there's lots of layers that probably will never come out into the research, but I do think that both males and females struggled with levels of support and also what their resources were at the end of the day for whether or not they could support other people. So I think it was a couple-fold.
Right. And did you find, because of the way society expects men to be, they can't show emotion and they get judged for it, did you find the men having more difficulty than the women?
No, actually what was interesting is that, let me say it this way. The women admitted difficulty, the women admitted difficulty, whereas the men basically do what a lot of men do, and they compartmentalized it, and they didn't really show a lot of their stress. What was interesting is that I interviewed, he was a primary care physician, and after the interview, his wife, who was a retired therapist, said, "Did you tell her this, this, and this?" And he said, "Oh, no, I didn't tell her that." And so she made him contact me and tell me what he really does when he gets home, that he's so tired he sits and stares at a wall. He doesn't interact with her. And so, and that he had a colleague that he had worked with for 40-some years who died from COVID. And then he had a patient who was one of his longest-standing patients, an elderly patient who had died of COVID. And he never mentioned any of that in our interview, despite me asking questions about how this had affected him. And so it was kind of interesting because she made him contact me, and then she said, And I think you also need to interview spouses, which I did start doing, and I was getting a different story about the male healthcare workers from the wives than I was getting directly from the male healthcare workers. So I do still think that there's this idea from males that they can't share, that they can't show vulnerability, or that they're trained just from day one of life to minimize the emotional aspects of life. So that's why I think we're going to see more of this coming out probably in the next few years, because I don't think that the reporting is accurate.
Yes, I agree. I think, and I talk about this a lot on my shows when I talk about mental health, that men, we need to start, first of all, we need to start teaching our boys when they're young that it's okay to express emotion, that it's not weakness. That's old school. I call it old school thinking, got to be like John Wayne, strong, silent type. That's why men have heart attacks. That's why they're more prone to suicide, because they are afraid to express their emotions. They're afraid to say, you know what, I can't handle what I'm going through, or what I experienced, what I saw. And men should be allowed to do that, just like women. Everyone should be allowed to have mental health care for whatever their issues are. And it should be safe. It should be safe for a male doctor, a male nurse to say, you know what, I need help. And for females also, but I think it's more stigmatized for men even in today's day and age, and that needs to stop. That's how I feel. I get on my soapbox, but
I don't think it's a soapbox at all. It's a reality.
Yeah,
and
definitely.
Even when I was a professor at the medical school here in North Carolina, one of the things I would teach the residents was really that they had to consider differences in reporting according to gender, because males and females have a very different style for what they report to their own primary care physicians or their own healthcare providers. Because if you ask a woman, how are you doing, she's going to tell you. If you ask a man, he's going to say, oh, I'm fine. And that's it.
Yes. And
if,
yeah. Go ahead, Dr. Kelly.
And if you don't have a practitioner who knows, oh, okay, so he's not really telling me everything, and he or she takes it at face value, they're not going to dig any deeper. And they're not going to understand the nuances of gender reporting, but then also they're not going to understand the nuances of how males and females manifest or store emotional information.
Yeah, that's very true. And as physicians or nurses, we have to kind of look for things that the patient is not telling us, like kind of being a detective. But what drives me up the wall, Dr. Kelly, and I can't stand when people told me this. I don't like it when people say, be strong. I didn't like it when they said it to my son and I. I don't like when I hear other people say that, because this be strong mentality hurts people, because then you think, oh, well, I have to be strong, so now I can't express how I feel. And as you know, I don't have to tell you, you're the psychologist, when people don't acknowledge and validate their feelings, it's going to bite them right in the rear end. It's going to come out. Anger or, an illness. And we have to stop that. I mean, I don't know why people say that. I know it's like the old school mentality, because my mom used to say it to me. But, when you see people dying, and it's different when it's your loved one, but when you see all these people dying, we all have a breaking point. How can you how can they expect people to be strong when they're seeing this day in and day out? You can't be strong all the time. And this is, we have to allow these healthcare workers to say, you know what, you don't have to be strong all the time, and maybe to have support groups for them in the hospital, and so that they're not stigmatized. Is that going on, or hospitals having support groups?
So what's been interesting, when I was interviewing, a couple different levels of things seems to have been transpiring. A few centers had really come together and created task force or other kind of enhanced their physician or healthcare services for supporting them. But what was really interesting was that a lot of it was done through written literature. A lot of it was done through sending emails, posting posters, things like that, which really are not that effective. And I heard a lot of resentment about that. I heard a lot of people say, if I see or read one more thing about how to be a resilient practitioner, I think I'm going to, cry or scream or whatever. Because they were getting information, like you said, be strong. Well, even the resiliency information out there was feeling like it was in their face, but not meant to help them. I also had different people telling me that they would never go to an in-house employee assistance program or counseling center because their colleagues would see them walking in. So many of them said, if I went, it would be outside of the system. One medical school, and I won't tell you which one, I am pretty close with one of the, in close contact with one of the deans of the medical school. And it's fascinating because I asked him, several things about how they were doing, both physician care, medical student care, all of that through this. And one of the things he said was, I don't know who made this decision, but they put a physicians, basically a room for physicians to go to be counseled. It was a good idea. They put it together, but they put it right in the middle of the medical school where all of the students go through. And he said, I don't know who thought that was a good idea, because what attending physician is going to walk through a medical school and walk into a counseling office while their students are watching them walk in? And I'm sure the utilization was low. So I think there were some things that were being done that were well meant, but the problem is they weren't well thought out.
Right. Yes. I agree. When I interviewed the emergency room doctor, she said that, if they went for help, they were penalized. They were stigmatized by their coworkers and the license board. And, that's just so wrong, in my opinion. I would rather have a doctor go for mental health, get themselves, get the care that they need, than for a doctor to be going to taking drugs and alcohol to numb their pain because they can't go for mental health. I mean, that's what I would rather have. I want a doctor who's mentally healthy as possible and not having to go to the drugs or alcohol. We need to, I think as a society, Dr. Kelly, to be more understanding of people's mental health care issues. Mm-hmm. And that, a baseball player gets hurt and they go get, taken care of. Well, when someone's brain isn't functioning or they are in emotional distress, they need care. And they should have it. And my heart aches for these doctors and nurses and other medical professionals that went through what they went through. It is kind of like a war. And in a war, what do you have? You have post-traumatic from what they witnessed. How can you not? You know, these men who and women who fought, and they are forever bonded when they go through that experience. So I could see someone having an emotional affair with someone who is also experiencing the same thing, because you had that bond that you went through this together. It's that way with caregivers. You know, we have a bond, a sisterhood, a brotherhood, because we went through this. And I can, you know, truly understand that. But, you know, we as a society, we need to start treating our nurses and doctors and other healthcare professionals better and having, you know, respect. I'm not talking about worshiping them or the hero worship, but let them get the care they need. And I don't care if I sound like a broken record. You know what? I went for counseling. I always recommend counseling. It's not a sign of weakness, you know, contrary to what I was brought up with. I'm a baby boomer. And it was not cool to go to a therapist in 1974 like I did. It was not a cool thing to do. But you know what? When you need help, you need help. And we need to start helping these health professionals, or there won't be anyone taking care of us, because you know what, folks? They're going to be leaving. They are leaving. And I heard, you know, a lot of physician's assistants might be taking over because there won't be enough doctors. There's not going to be enough nurses. They're retiring in droves.
There certainly won't be in the immediate future because there are so many people that are either retiring or just quitting and changing jobs outside of healthcare. A couple things that I think you'll find interesting. Three things actually. One of which is one of the physicians that I had interviewed, and she was actually a client of mine. She admitted to me right before the pandemic that she had never heard the word self-care before I asked her during our intake, because I always ask, what do you do for self-care, no matter who the person is? And she, about 2.5 years later, admitted to me that she had been pondering that for 2.5 years because she did not want to admit it to me that she had never heard the word. And I was fascinated by that she had never heard the word self-care and never really thought about what to do to take care of herself. Fascinating. Part two, one of the things that I think is fascinating in general is the definition of health that a lot of healthcare practitioners have. Because to me, again, I'm a holistic health psychologist. I look at all aspects of health, and it's interesting to me that people are taught and versed in how to help others access mental health, or at least ascertain whether or not they have mental health concerns, but they forget to turn the mirror on themselves. I think that's another fascinating part of this. And then this is not fascinating, but this is exactly why I created what I call my soul health model, because 27 or I don't even know how many years ago it was, when I was working for a student health promotion department, I was in my training as a master's level student. And what was interesting is while I was being taught about assessing a sick patient or, you know, someone with mental health concerns, at the same time I was working for student health promotion of that same university and being taught wellness models. And the wellness model for the National Wellness Institute has 6 different components to it, which I thought made so much sense, because that model has physical, psychological, social, environmental, intellectual, and spiritual health as their main components. And this model has been around for decades. As I was being taught in my master's program, I realized how applicable that model was in what I was learning as a counseling student. But I also realized that there were, I call them branches, but there were 4 components that were missing from what I heard clients talking about almost every day. So later, after I got my PhD, after I left the medical school, and after I was in my own private practice, I decided I was going to create my own model to help people understand that there are several different components of health that are never talked about in a healthcare system. And I really wanted to create this as a method or a pathway for patients to know how to advocate for themselves. What I didn't realize was that I would end up using it so much to help teach healthcare providers how to work with patients as well, because I traveled the country and I did local workshops for healthcare providers teaching them this model. And inevitably, I had so many of them come up to me and say, gosh, we wish we had this when we were getting our training, because it's an integrative model that shows that psychological health is so key to physical health that you can't have one without the other. And that's one of the reasons why I used this model to help healthcare providers learn how to recover in this book. Is I really wanted to emphasize the mind-body connection to what they were experiencing, if that makes sense.
Oh, definitely. Definitely. Oh, I love talking to you, Dr. Kelly. Yes, because when you are not, in a good mental state, if you're stressed, depressed, anxious, it affects your body. I know that firsthand. I know what it does to my body. And, when you are under stress every day, it's not good for your body, your health, and your health will suffer for it. Absolutely. I definitely agree with that. I want to thank you, Dr. Catherine Kelly, for coming on. I could talk to you for hours. You are such a resource and a wealth of information. And I'll tell you, I hope, even if you're not a healthcare worker or nurse or a doctor, I think everyone should get this book, The Healer's Path to Post-COVID Recovery, A Restorative Journey for Healthcare Workers. Holidays are coming up. Do you have a favorite nurse, a favorite physician's assistant? This would be a great gift to give, to show your appreciation. Do you have a healthcare worker in your family? Or just read it to know what they went through. I think it's a wonderful book, and I love the cover of it,
Thank you. Yeah.
which is really pretty. And, I just really think that this book is very necessary for today, and thank you for writing it. Dr. Kelly, I know people can get your book at Amazon and your website, and your website is the one for the books. Is that the Healer's Path books.com or www.drcatherine?
Either one. So you can go to the healerpathbooks.com, or you can go to www.drcatherinekelly.com and look at my books page, and you can get it either place. You can get it on Amazon. And yes, absolutely, I think this is the perfect thing to give to your healthcare providers for Christmas, or also to your family members who are healthcare providers or who have been affected. I've had many, many people tell me that they would not have had a path to healing. I actually had one healthcare provider tell me, one of them that I interviewed, tell me that I saved his life by providing him with this information, and that was shocking, but also I was so grateful that I had called him to interview him. So there's a lot that needs to happen to rebuild, and I think every little bit helps.
And how would someone who's a healthcare worker contact you if they wanted your counseling service? Do you counsel in other states, or just where you're located?
So from a licensure perspective, I can only do therapy in North Carolina. However, one of the things that I have been doing for years is I've been doing, two different things. I've been doing coaching, so kind of health coaching with healthcare providers, and I can do that anywhere in the world. I have clients actually in different countries. And I also have been doing a lot of work with healthcare administrators. I'm actually doing some consulting with a treatment center that really kind of fell apart during COVID. I'm doing a lot of that work to help them know how to help their healthcare employees. So I'm a busy girl, but I love being able to offer this to as many healthcare providers as I can, including if I can train other healthcare providers and if I can talk with the administrators, I feel like at least I'm providing tools that will trickle down. So it's a passion of mine and it's a mission of mine. And so although I can't really do therapy between other states, I can definitely offer other options for people.
And if somebody wanted coaching from you, do they contact you by your website, the Dr. Kelly.com?
Yes, they can. Yeah, go through my website. They can. There's a sign up. In fact, I'm going to be launching a new website in a month or two, and so it'll have a lot more information out there, both about the Healer's Path and other services. But yes, they can go straight to my website and then call my office. Yes,
and I'm going to check out your YouTube channel because I went on your website and I didn't have time to look at your YouTube channel, and I'm going to share the link that will be in the blog. So all the information about Dr. Catherine Kelly will be in the blog. So please read the blog. Jeannie White, who's station manager, writes. Thank you, Jeannie. And Jeannie White produces the show. She's station manager. And I want to thank Lillian Caldwell, CEO of Passion World Talk Radio, that makes this all possible. Again, Dr. Catherine Kelly, thank you for coming on. Thank you for what you do. I could tell that you are very passionate about what you do, and I just am very grateful for people like you who are helping others through a very difficult time. And I appreciate what you're doing for people.
Thank you. And thank you for having me on, because I do believe this is a really important topic, and it's something we all need to think about. Whether you're a healthcare provider or not, it's just important. So thank you so much.
Oh, you're welcome. Yes, I'm a big mental health advocate. Folks, check with your primary care physician in your area if you do need resources, because it's different everywhere. There are places who do operate on a sliding scale fee according to your income. And for those who are seniors, I know my senior center where I live offers free counseling if you are 60 and over, and I do get free counseling. So I'm not ashamed to say that. I pay taxes, so whatever's for free that I can get, you better believe I'm going to take advantage of it. So check your local senior centers where you are and see what free resources they offer. And I just want to tell everyone, thank you for listening. Please share the show to help other people. If you know a healthcare worker, share this show. Tell them about Dr. Catherine Kelly. Give them the book to help them. And, my mission and vision is to help other people and to have resources and to have people who provide resources to help others. And that's what my show is about, is helping other people. And so when you share the show, you are helping me help others. So I want to thank you, everyone who does subscribe and share the show. If you don't already subscribe, it is for free. Chatting with Betsy is on Spreaker, iHeart. You could also listen to my show on PassionateWorldTalkRadio.com. And also it could be heard on YouTube under Passionate World Talk Radio. So I want to thank everyone again for listening. And as I always say at the end of my show, in a world where you could be anything, please be kind and shine your light bright, because if we did our inner work and shined our light bright and were kind, this would be a much brighter, happier, peaceful world. Until we chat again, this is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio. Bye-bye now.